Welcome to the Illuminating Primary Care Podcast, a general practice podcast brought to you by Menlo Park Recruitment. Illuminating Primary Care is here to quiz primary care leaders to offer professional knowledge, experience, and insight on the biggest topics in general practice. It's the podcast to listen to if you work in primary care. Welcome to the Illuminating Primary Care Podcast.
I'm David Murphy, your host today, and I'm joined by Dr. Janki Patel, an NHS and private GP currently working for Nuffield Health, who are one of the largest healthcare charities in the UK and an organisation we partner with on recruitment. So hello, Janki.
Hi, how are you?
I'm good, thanks. Janki's very kindly allowed me to interview her today to provide a bit of an insight into the opportunities available to GPs in the private sector, as well as the benefits of portfolio career alongside NHS work. Firstly, Janki, could you tell me a bit about your journey to qualifying as a GP? Was it something you always knew you wanted to do?
So my story is that I come from an Indian family, so being a doctor was obviously one of the things that Indian parents push their children to go into. But as it turned out, it was the right decision for me. So I went to medical school in the Midlands and qualified in 2007. Did my foundation training for a couple of years. Where we, experienced a different bunch of specialities. And then at the point during the second year of foundation training, which is when you normally apply for your specialist training, I didn't exactly know what I wanted to do. So a bunch of friends and I went to Australia, and then we did A&E out there for a little bit. And then while I was out there, I decided that the GP training looked really good because it allowed you to experience a few more specialities: obs and gynae, peds, cardiology, A&E again in the UK. And then I thought that would be the most valuable use of my time because I didn't really gravitate towards any other specialty. So then I came back from Australia and signed up for GP training, and then finished that in 2013 in the Midlands.
Oh, brilliant. What led you to a career as a private GP?
So when I finished my GP training, I'd had quite a challenging year with my trainer, and at that point I decided I didn't want to commit to a particular place without getting a bit more of an idea of what was around, what kind of teams there were, and how people sort of work together, because it is a big decision when you're applying for jobs. So I decided after that to locum for a little while in the Midlands, and then I came to a point where I couldn't find really a job that I wanted to commit to, and then a fellowship came up, which was again largely based in hospital as well as GP in urgent care. And then after that, I decided I wanted to move cities, and I signed up to some locum agencies and a recruitment agent, and they submitted a couple of jobs to me in the private sector, and I thought, oh, I'm going to have a look at this because I didn't know London at all. I was in the process of buying a flat as well, so I wanted some stable income. So I decided to apply for the roles, and the interview at Nuffield was really good, and I really liked what I learned about the company and what they stood for, and that it was not for profit. And I thought that if I was selling my soul, so to speak, it would be a good way to do it, because it's still a charity, not for profit, and they're really, their ethos is to sort of promote health and well-being, which is a good ethos to have, really, which is what we're trying to do in our jobs.
Yeah, definitely. And was it something you thought about during your GP training? So was it kind of within your sphere while you were going through training? Was it something you'd kind of given much thought to or were aware of prior to being spoken to about it by another agency?
Possibly, no. In all honesty, no, because back then I think I was a bit more idealistic, and it didn't seem like that's what you went into healthcare to do. But I think as you'll learn as a GP, even from matter of 1 or 2 years of doing the job in the NHS that you kind of have to do what you need to do to work best. And if you're trying to do 5 days a week in the NHS GP, and I know a few people who do that, and I completely respect them for doing that, but it's just not something that's within my capability. I need a form of respite and a different sort of challenge, a different pace.
Yeah.
So the dual roles work really well for me.
Did you have any preconception of what being a private GP would be like, and were there any differences once you were in the job?
Yes. So I think in my naive self, I thought it would be very corporate and soulless, and you're just pretty much there to be just someone who agrees to everything a patient wants. And it's not like that at all, especially through Nuffield, which is, I guess, my only experience of private GP. You still are an autonomous practitioner, but there are specific guidelines and operating procedures within what you can and cannot do in this sector. So you're not just there to do what someone asks. You're still there to assess the situation, assess the problem, and still advise on what's clinically necessary. And you don't have complete free reign as a practitioner just to prescribe this, that, and the other, and recommend a full body MRI for everyone. It doesn't work like that.
So how long have you been with Nuffield for now?
I joined in 2016. I'm still there today. So it's been a few years.
So how has working for Nuffield Health positively impacted you?
I think it has massively, actually. For one, like, you're constantly working with young, newly qualified sports science students. So they're frequently telling you how to, improve your exercise levels and your nutrition and things like that. And actually working here and advising people about their health has made me healthier as well. Nuffield, obviously, one big aspect of the charity is the gym, so all the employees get free gym access to any of the gyms, which is really good because gyms cost a lot of money, and it's good to have that. You can also get discounted rates for your spouses and things. So my husband really appreciated that. The other thing I really noticed is that in seeing a lot of these clients, I've met some really inspirational people, people that, people who have impressive careers, and, CEOs of global firms and things like that. People I just would never really ever be able to speak to. And it's sort of confidence building, and confidence building knowing that you can hold your own, talking to them for an hour, and being able to advise them on things they may not know or be aware of. So it is really rewarding. There's a lot of employee benefits from Nuffield as an organization as well. Like you have access to opt into private healthcare if you need, which I'd never had before. There's other schemes like cycle to work schemes, and like reduced cinema tickets, which I love.
It's the little things, isn't it?
Yeah. It's just been really positive for me. I've met a lot of people. My colleagues are great. It's a real sort of a good cohesive team across London, and at each of the health centres that we have. So it's really good. I really enjoy it, and I'm glad I worked for them. I'm glad I still work for them, and hope to work for them for a good while.
How has the role changed, or how has the role developed for you the longer you've been with them?
So when I signed up, the primary role was as a health screening GP. So the work was, you would see largely corporate clients to do various health assessments, depending on what their employee benefits entitled them to. And it was largely an exploration of their health and how you can improve it, or how you can advise them to improve it through their lifestyles and making necessary referrals if they have various things that need further input. But then later on, once you're comfortable in that role, they offer you, if you want to train, just to see people for GP appointments that have signed up. It's not a big part of their workload day to day, but it is part of the role. And then they have a lot of corporate clients, so finance firms, legal firms, media firms, where they have sub roles as an on-site GP for those employees in those firms, where you run GP clinics for that site. Then there's training opportunities to train new doctors and things like that. And there's if you want to, you can sort of work your way towards more clinical lead type roles.
Would you say there are any benefits to working in both the private and NHS settings as a kind of portfolio? So doing both at the same time, because I know that's obviously one of the criteria Nuffield like to kind of offer.
For me, definitely, because it's the two types of job. Even though you're doing the same sort of work medically, that it's an entirely different environment. And being an NHS GP obviously lets me keep my skills up. I still get the exposure to all the demographics and awareness of what guidelines are happening and what is standard practice. But the private sector helps me utilize those skills in a way where I actually have the time to be a good GP. There's fewer obstacles in referral pathways and things like that, which sort of makes it easier, and there's more time. But if I didn't have the NHS as a point of reference, I think it would be different. But for me, it's just having the comparison that lets me enjoy these private days a lot more, because I feel confident in what I'm doing because I have the experience from the NHS.
Yeah, definitely. And I guess from a clinical perspective, does the work differ quite differently from the NHS roles that you do compared to your private post with Nuffield?
To some extent, yes, because for my role here, you're particularly skewed into seeing the working population, the working demographic. So you don't see any children, you don't see any frail elderly. So the pathology you're going to see is going to be of the working well people largely. So it's a good thing normally, because that's a demographic you don't see that much of in the NHS, because they're going to be typically the people who you won't get to see proactively. They'll only come if there's a problem. And work constraints and things sort of delay that. But this gives you the opportunity to see them, deal with their problems, and also advise them on how to improve their health and promote their long-term well-being. So there is a difference in the demographic. The expectations are also different. I mean, to some extent, they're the same, because the expectation of someone seeing a GP is that they want their problem addressed and they want it sorted as quickly as possible. So that's not going to change.
Yeah.
But the expectations of speed and how things are going to be managed are different, because they may have access to insurance and things that are going to allow them to see various specialties and have various tests done a lot more easily.
Yeah. And just rewinding a little bit, I mean, you've obviously mentioned the working well, or seeing a lot more of it that you don't necessarily see within the NHS. Do you think that kind of changes the focus within your role to kind of more preventative and lifestyle medicine, rather than kind of like firefighting that a lot of GPs get in NHS settings, where people are coming with 6 problems?
Absolutely. I mean, not to say that doesn't happen, because it does. Yeah, especially post-pandemic, which has pushed a lot of these people into having to see us rather than the NHS GP. But you've got definite opportunities to promote lifestyle medicine and nutrition and exercise, which is something I just very rarely get the opportunity to do in my NHS job. It just ranks so low on the priority list of problems they will present with. Whereas I think actually fundamentally it's really important, because we're trying to prevent the problems of a whole nation, a nation that's going to be aging, and that's largely the problem we're suffering now is we've got an aging population with complex needs. And if you could have given reasonable advice at the earlier stages, then people would be a lot more healthy, and they may have a lot more onus into how they can improve their health themselves to minimize future problems.
Definitely. And again, just something you said, which is really interesting about the pandemic pushing more people you might not have otherwise seen towards, private healthcare and providers like Nuffield Health. Do you think that will change what private healthcare looks like? This is a massive question, so sorry for springing it on you. But do you think that's going to kind of change the sort of preconception of what private healthcare is, and actually how we use it, or how we see the people or view the people that use private healthcare?
I think it will, because having experience of both sides is that nobody really wants there to be an access to a doctor. No one wants that to be a problem, but unfortunately it is. And it's because we have a retention problem in the NHS, in the public sector, because of, a lot of older doctors retiring and people not wanting to work as much because it's too stressful, or they've just burnt out or moved elsewhere, or moved careers, moved countries. So that is going to be a massive issue. Because of the lack of access, it may push people or force people into purchasing insurance or self-paying to see doctors privately. And then up until now, the private sector probably wouldn't have been used to that workload. So equally, they're going to have to adapt as well and recruit, which obviously is something we're trying to do right now with the podcast. So I think I used to have this impression that, the private sector was just going to be privileged patients, and it largely is to some extent now. But ultimately, people need access to healthcare, and there needs to be provision of healthcare to people in some shape or form. How that will look, I'm not sure. But as a nation, we need to also look after our doctors and our healthcare staff. So
massively.
If you provide job roles that allow them to do their jobs well and go to bed at night feeling rewarded by what they're doing, and they've been able to work in an environment where they think they can do their job well, then that's massive.
Yeah, definitely. And from a recruitment perspective, is there any advice you would give to GPs considering jobs within private health or jobs with Nuffield Health? Are there any sort of benefits to their career, to their sort of personal development? Any areas you think advice could be given?
So I would say I would definitely recommend it, whether it's to supplement income or whether it's as a single role. I definitely recommend it, but I'd recommend people to research the organizations they're looking to work with, to see if their sort of ethos and their philosophy is aligned with their own. I'd have a good think about how you would deal with this demographic. The complaints culture, across the board is high, but for this sector, people are a lot more ready to give feedback, particularly negative feedback and criticism. And you need to have a thicker skin about that stuff. So be aware of that, and be mindful if you're exclusively doing private work, then you need to keep your skills up in various areas with guidelines and things like that, because at Nuffield our GP workload in terms of private GP appointments is not a big chunk of the workload, so we only really see people ad hoc. We're not managing anybody exclusively, so we tend to not really take ownership of chronic disease or sort of long-term medications and things like that. We only sort of do that ad hoc if it's really necessary, but that sort of healthcare is still meant to be provided by the NHS GP. So we're sort of more troubleshooting new problems, assessing day-to-day problems and making referrals if necessary, but we're not managing any sort of chronic condition long-term.
Yeah. Brilliant.
Because that's not what the service is designed for.
Yeah, no, so it kind of ties into what we were saying before about kind of preventative lifestyle and kind of slight difference in demographic that you're getting through. But no, that's been really useful. So thanks, Janki, for taking a bit of time out of your day to have a chat with me about this. I think it's been really useful just to get a bit of an insight into your sort of life as a private GP, but also your background and a little bit about the NHS work you've been doing as well. So yeah, thanks for taking the time to.
You're very welcome.
You've been listening to the Illuminating Primary Care podcast. If you enjoyed our podcast, please subscribe, review, and share so others can find the podcast too. We really appreciate your support. If you're a practice looking to recruit permanent clinicians, such as GPs, nurses, or allied health staff, please get in touch at menloparkrecruitment.com or email james@menloparkrecruitment.com. For daily primary care news, please follow Menlo Park Recruitment on LinkedIn. Thank you so much for listening, and we hope you'll join us next time for another episode of the Illuminating Primary Care podcast.